Hello guys, Assalamu alaikum. My name is Dr. Faraz Ahmad. So in this video we are going to talk about those medical students who are in their medical schools, who are in their medical universities, are those doctors who are currently doing their house job and those doctors who have completed their house job as well and they are looking for the medical officer job or they are doing the medical officer job. So I am going to discuss from A to Z, like if you want to come to United Kingdom to do the postgraduate training, to do the non-training job over here. So what is the process? So first of all, there are 4 to 5 steps in the road to UK. I will definitely try to cover everything in 8 minutes. So the first step, like you have done your MBBS, you have done your 1 year house job as well. So now you are Pakistan Medical and Dental Council registered doctor. So are you planning to come to United Kingdom? Yes, if you are planning to United. So the first step is language exam because we are non-English country and to work in the United Kingdom, which is an English speaking country, we have to clear their language exam. So there are two types of the exams which are acceptable over here in the United Kingdom for the English language test. These exams are OET, Occupational English Test, and the IELTS. So you must be knowing about both, but the thing is that what I will recommend you people, although OET is very expensive exam, like in a single fee of OET, you can appear in the IELTS exam 3 times. So these days, OET fee is 587 Australian dollar, and I think IELTS fee is around about 50,000 to 45,000. So I'm not clear about the IELTS. So to appear in OET, I will recommend this because this is totally medical oriented exam. In OET or IELTS, you will be assessed in 4 subtests, including writing, speaking, listening, and the reading. And in OET it's very easy because everything is related to your medicine which you have done in your 5 years of the MBBS. But keep in mind, it will not be related to your medical knowledge. So in the writing, you will have to write a letter. You are writing these letters from your junior classes, from your secondary school, from your high school. So here you have to write again same type of letter, but it will be related to your patient. It could be referral letter, it could be discharge letter, or it could be transfer letter. So after this, after the OET exam, let's suppose you have passed the OET exam. So congratulations. So now you are eligible to go for the GMC website. And after creating an account on the GMC website, what you have to do, you have to look for the PLAB 1 seat. So battle starts here if you have cleared the OET exam and now you will be looking for the PLAB 1 seats. Please keep in mind, these days, although it's very competitive to get the PLAB 1 seats, but in our time, when it was COVID-19 time, so it was very difficult to get the PLAB 1 seat. Fortunately, at that time, I got a seat of the PLAB 1 from the cancelled seats because I was not able to secure a seat when GMC released seats. So after getting the PLAB 1 seat, what you have to do, you have to prepare for the PLAB 1 exam. Please keep in mind, PLAB 1 exam is the most easiest part of a doctor's life exam. So like I prepared for the PLAB 1 exam for 18 to 20 days and fortunately I was able to pass the exam. Although I got just passing marks in the exam because I was not able to prepare well for this exam. But it is very easy exam. Believe me, it is very easy exam and you can easily pass that exam. So congratulations, now you have passed the PLAB 1 exam. So what is the next step? So this is the biggest battle. Now you are going to book for the PLAB 2 exam. So the PLAB 2 exam only held in the Manchester in the United Kingdom. And now for the PLAB 2 seats, the candidates from whole of the world, candidates from more than 220 countries are competing for the PLAB 2 seats. But keep in mind, yes, easily you can get the PLAB 2 seats as well. Although you could have to wait for the PLAB 2 seats for 6 months, 7 months, but definitely you can get PLAB 2 seats. And if you have gotten the PLAB 2 seats, your main aim should be like, I have to pass the PLAB 2 exam in the first attempt. Please keep in mind, GMC has very clearly written on their website that in the PLAB 2 exam, we are not assessing your medical knowledge. We have assessed your medical knowledge in the PLAB 1 exam. In PLAB 2 exam, we are not assessing your medical knowledge. Then what they are assessing? They are just assessing in the PLAB 2 exam, either you are a safe doctor or not. They are assessing your communication skills. Please keep in mind, there are 16 stations, total 16 stations in the PLAB 2 exam. What does it mean? What is the mean of stations? Like you are in the final year, you are in the 4th year of the medical schools. Definitely you have to go for the OSCE exam after your written exam. So this is similar to your OSCE exam. PLAB 2 exam is similar to your OSCE exam in your medical college. So out of 16 stations in the PLAB 2 exam, maximum 3 to 4 stations will be from the history taking. What does it mean? So after taking the history, you will have to make a diagnosis, temporary diagnosis, and after the diagnosis, you have to discuss about the treatment option, precautions, and the red flag to the patient. Okay, so what about the next of the stations? Like what about the 12-13 stations? 12 to 13 stations will be from ethics and from the counseling, from the medical counseling. So this counseling and the medical ethics are so important over here is that the GEMC is covering their 12 to 13 stations out of 16 stations in counseling and the ethics. So this is very important. Like if you are good in the counseling, if you can speak very well, definitely you can pass the exam. So let me tell you one important thing. If you are preparing for OET, you are preparing for the OET speaking part. So all the role play cards which are there in the OET speaking PLAB 2 exam counseling station are similar to those stations. So please keep in mind, if you want to go for the English language exam, so this is the reason I am suggesting OET exam, because if you are very good in the OET speaking, definitely it is going to help you in your PLAB 2 exam communication skills stations. Okay, so let's suppose you have passed the PLAB 2 exam now. So now what is the step? You have to go for the GEMC registration and you will apply for the GEMC registration. Within 1 week you will get the GEMC registration. So you are GEMC registered now and you are allowed to practice medicine in the United Kingdom, but this is not the end of battle. So what you have to do? Now you have to make account on the different websites, including Track website, including NHS website, NHS Scotland website, NHS Northern Ireland website, and you have to apply for the jobs over there. So let's suppose you have applied for a job and you have gotten some interview over there. You will appear on the interview, and after the interview, if you get selected, you have to come to United Kingdom to start your first job. So this was all about, like from A to Z. I have mentioned that if you want to work in the United Kingdom as a non-trainee, or if you want to do some training in the United Kingdom, what is the process which is most easiest and which is not so much lengthy. So you will start with the OET exam, you will start with PLAB 1, PLAB 2, GMC registration, and then you will apply for the job. And after having the job, definitely, if you have some NHS experience, you can go for any of the training of your choice. So that's all about the today's video. If you want to ask any question, you can follow me in the Instagram, you can directly message me over there, or you can ask me any query, anything in the comment box of this video as well. Thank you very much.